Today on Dueling Doctors, a problem that most likely affects you or someone you know and love: pain. It is estimated that 100 million Americans suffer from some form of chronic pain, and that we spend $2.5 billion on over-the-counter pain medication. Today we're talking specifically about treating migraines, menstrual cramps, and back pain. Doctors from the worlds of holistic, natural, and conventional Western medicine square off on how to help you find relief. And they have plenty of great information for you right now. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the worlds of both conventional and holistic medicine join us to debate and discuss the best ways to treat all kinds of ailments and illnesses. Let's get started by introducing our guests. From New York City's Langone Medical Center with a specialty in rheumatology, we have Western-trained Dr. Natalie Azar. And on the eastern side of the equation, licensed and board-certified acupuncturist and clinical herbalist, Noah Rubenstein. Welcome, both of you.
Thanks for having us.
Frank.
We're going to get started off by talking about migraines, which affects 25 million Americans. A migraine is an intense throbbing sensation of the head, commonly accompanied by nausea, vomiting, and an extreme sensitivity to light. Migraines can last hours and days and leave sufferers completely unable to do anything but rest in a dark, quiet place. Now you know what it is. We talked about what causes it. How can we treat them? Each of our experts has up to 1 minute to present a treatment plan, and then the other will have the opportunity to respond. We flipped a coin before the show to see who would go first, and Dr. Azar, guess what? You won.
I won.
So talk to me. I'm a migraine sufferer.
Yeah.
So I know a little bit about migraines. So what do you, I find actually as a internist,
yeah,
it's one of the hardest things. Patients come in with headaches, migraines, it's really difficult. So what is your approach, basically?
Well, first, you want to establish that it's truly a migraine. You take a good history, and that's probably all you need. There's no laboratory or diagnostic testing that really needs to be done. The way I approach it with my patients is a three-pronged approach. Yeah. I want them to keep a headache diary so they can identify their triggers. The second thing we talk about is how to treat an acute attack. And the third thing we talk about is whether or not you need prophylactic or preventive medicine. We basically think of three main ones. Hunger, fatigue, and stress are the ones that most patients complain of. Certain patients definitely have food triggers, MSG, you know, there's a sort of a historically common one.
Food triggers would be like caffeine, chocolate.
Or caffeine withdrawal.
Caffeine withdrawal headaches are very common. Foods with like tyramine, especially like aged cheddar,
exactly.
Some
and
stuff
it's
like that.
and it's not the same for alcohol
can do that
as well.
Okay, so now I have a migraine.
You have a migraine. The first line therapy can be as simple as over-the-counter ibuprofen, which is the generic ingredient found in Advil and Motrin,
so
for example.
Over-the-counter anti-inflammatories.
Over-the-counter anti-inflammatories, as well as Tylenol. Sometimes you can find these with Tylenol and a salicylate, which is an anti-inflammatory plus caffeine together in one pill.
It's interesting that caffeine actually can.
Right.
My mother used to give us a little bit of espresso.
That goes to really?
Yeah.
When you were little?
Kids, yeah.
It's interesting.
I know, don't call child welfare, I'm okay.
Right before bed. That actually speaks to the old theory about what was causing migraine. Was they thought it was sort of this vasodilatation or opening of the blood vessels that was causing headaches, so the caffeine would constrict, which is no longer really, I think,
and what's the real common belief now? It's
the going theory is that there's some brain excitability in the cerebral cortex.
Triggering.
Yeah,
okay.
exactly.
So
more of a neuron thing.
Right.
Exactly.
All right. So, but the issue is most like if you're a migraine sufferer like myself, I don't go to my doctor. I just go to the over-the-counter.
You can do that.
Get that. And then what would you do, again, if it's happening and it's not working?
Right.
That Excedrin or whatever I did at home, whether it's natural or not, is not working.
If you're getting migraines that are, first of all, if they're lasting for more than 72 hours, you need to get help, okay? That's called a status migrainous. You need to abort that, most likely in an emergency room or with a doctor. But if you're finding that you're getting attacks more than 2 or 3 times a week, you definitely are a candidate for possibly prophylactic medicine or a medicine that's a bit stronger to abort an attack. And those classes of drugs will be the triptans, like Imitrex and Sumatriptan.
And these can be given orally and injectable.
And the pharmacological route is really dependent on patient preference, patients who have a lot of nausea and vomiting would certainly benefit more from an injectable route rather than having to take it by mouth.
But they have side effects. I know, like I've taken it and I get cold. I get weak sensation, like cold and hot
and
flashes.
Flushing and things like that, right?
All right, Dr. Noah.
So from a Chinese medical point of view, migraines are energy that's flowing in the wrong direction in the head and gets stuck there, and it's that stagnation that causes the pain. Chinese medicine is a great way to safely address some of these problems. There was a meta-analysis of 22 studies that showed that acupuncture can be as effective as a lot of conventional therapies. Acupuncture is an effective way to break the pain cycle, but also act as a preventative. We're learning more and more about what causes them, and there's a lot of evidence that shows that there's a genetic component to it, but there are also a lot of precipitating factors that we can have a profound effect on. The triggers. So acupuncture can be used to reduce the frequency, the duration, and the intensity by itself, and there are studies that show that. In addition, herbal medicine, lifestyle recommendations like the ones you mentioned.
Now, what about, you mentioned acupuncture, is that the same thing as acupressure? Because I do this thing where I squeeze the base of my thumb on the side where I have the migraine.
Right.
Would you recommend that as a quick little?
Absolutely, that's definitely something to try. There are points that we use around the neck and shoulders, but there are also points in your ankles and your wrists, and that's a really common one between your index finger and your thumb in that muscly part of your hand. Yeah. And that, because of the way we understand how energy flows through the body, can be a great way to reduce.
And I also take magnesium. Do you recommend that as well?
Absolutely. Magnesium's a fantastic supplement because magnesium helps to relax the muscles that often are involved to some degree. As you know, if nothing else, the distress of the pain or the stress that's causing it can be a contributing factor, and magnesium can help with that.
And I also take feverfew.
Feverfew is a super supplement. One of the things that feverfew does is feverfew reduces serotonin surging in the body and in the brain, and serotonin has been implicated as one of the contributing factors.
So serotonin is a neurotransmitter that makes us happy, and usually low levels can be a trigger for migraines.
Exactly, and so feverfew is a good thing. And that's one of the reasons we also recommend a good probiotic, because part of serotonin's synthesis happens in the gut, and making sure your digestion is healthy.
And that's also why some doctors prescribe antidepressants to help with serotonin. But I just want to make an important point. If you are having a fever and a migraine, you should see a doctor, because it could be something more underlying like meningitis. But all right, well, thank you both. I learned a lot about how to treat my migraines. We have to take a break. Up next, a pain that affects almost every woman at some point in her life: painful menstrual cramps. Welcome back to Dueling Doctors, the show where health experts from the worlds of conventional Western and natural holistic medicine debate the best ways to treat ailments and illnesses that affect so many of us. Today's theme is pain. We're joined by licensed and board-certified acupuncturist and clinical herbalist Noah Rubenstein from the Unova Center. And from New York City's Langone Medical Center with a specialty in rheumatology, we have Western-trained Dr. Natalie Azar. It's time now to debate a health issue that probably affects women watching us right now: menstrual cramps. Painful menstrual cramps is medically referred to as dysmenorrhea. Symptoms are dull, throbbing pain in the lower abdomen that occur just before or during the menstrual period. During menstruation, the uterus contracts. Severe contraction can constrict the blood vessels of the uterus due to high levels of prostaglandin. Each of our doctors has up to 1 minute to present a treatment plan, and then the other will be given a chance to debate the pros and cons. Dr. Azar, you went first last time, so we're going to begin with you, Dr. Noah. I typically think of primary menstrual cramps as happening usually like in the first years when you start to get your period.
Right. Well, primary menstrual cramps can happen then, but they also can continue for years and years and years. So warm
water, maybe a warm bath as well?
Warm bath is good too, because a lot of the time the cramps that are associated with primary dysmenorrhea also happen in a woman's back. There are also points that we can recommend for women to do in their own self-care that aren't necessarily around their abdomen, self-massage, but also acupressure points can be
So you
very
can
effective.
massage your belly actually to help.
You can massage your belly. The warmth is good because warmth helps to get energy and flowing in the muscles
And
to
then you
soften
have
up.
trigger points.
And then we have points. They're not
Okay,
exactly
where?
trigger points, but they're points around the body that are associated with reproductive organs.
So give me one. Do you have
Let's see. Okay, a really good example, one that we
Let's see.
often do, is actually on your ankle. Or just above your ankle. And what we do is we show women that on the inside of their foot, just about 4 finger breadths above their ankle.
Okay. Yeah.
Exactly.
Gotcha.
So from your pinky up to your index finger, and then just about a half an inch back. In that area, if you rub gently,
Just rub it.
Just rub. They'll find, especially when you're having your period, that there are points. There is a point that will feel tender, and that's a good point to rub. 3 to 5 minutes, just gently. This isn't an endurance test.
Are you
how
sure
hard
it's just not directing the pain to my ankle, so I'm not worried about the pain in my stomach?
No. Actually, there is a lot of clinical data that shows that this is an effective way to reduce the spasms that are associated with primary dysmenorrhea.
Okay, and is there anything you can take orally that might help, like a supplement to help with cramps?
There are supplements. Getting back to the cramping itself, calcium and magnesium supplements are great.
Magnesium, very good, actually.
So that's one thing. There's actually an herb called cramp bark, which...
Get out. Cramp bark?
Cramp bark,
Oh,
and
it's easy to
it
remember.
does just that. It helps to reduce cramping.
Doctors are primary, I'm thinking, young women.
Yeah.
Secondary, I'm an older woman maybe, and I'm having painful menstrual cramps. What could this be? I mean, what would be your workup?
The teaching, the rule of thought, the teaching on this is that primary dysmenorrhea is something that many, many women will experience at menarche, or the onset of their menstrual period. It's common in adolescence and into your 20s. A lot of women go on birth control maybe in their 20s and 30s, and that usually helps with
Helps
those.
regulate it, right.
And then if they come off later in their, to have children, et cetera, they may start noticing that they're having bad cramping again.
Sure.
What we always want to make sure is that we're not missing another underlying organic cause for that
So you don't want to
pain.
just treat the pain.
Correct.
You want to find out what's causing
Correct.
it.
And probably the most common cause for secondary dysmenorrhea would be endometriosis, and that's when the lining of the uterus is growing outside of the uterus, like on the ovaries or the fallopian
Which
tubes.
is extremely painful.
Very painful, very easy to diagnose, very treatable.
And how would you diagnose it?
Ultrasound.
Ultrasound.
Yep,
So a
they do an
simple
pelvic
ultrasound
Uh-huh.
will tell you if you have endometriosis. What else could it be if it's
Fibroid
secondary?
tumors.
Fibroid, which are growths, which are usually
Which are benign tumors that
and
grow
they
in
can
the
be
uterus.
growing on the uterus, and they can cause extreme pain,
Exactly,
especially.
exactly.
And then even an infection like
Pelvic inflammatory disease,
PID or
correct,
sexually transmitted
correct,
diseases.
correct.
So if a woman comes in and you're not suspecting it's early, she's just having primary, you think secondary, you rule out medical causes.
Correct.
And then you find out it's none of those.
Right.
And then what do you think? What
Then I
would you
take
do?
Advil, and I take a lot of it.
Are you not worried about any of the side effects?
I'm always worried about side effects. Long term, but you're not. But this isn't chronic daily use of NSAIDs.
Not chronic.
Most women who take, and remember, you have to take an anti-inflammatory dose of Advil, not an analgesic or pain relieving dose. A pain relieving dose is 200 to 400 milligrams. An anti-inflammatory dose is 600 to 800
much higher,
milligrams,
right.
which is a lot higher. You can do that easily for about 48 hours without running into problems. But if you have a history of peptic ulcer disease, if you have a history of kidney, renal insufficiency or kidney problems, you have to be a little bit more cautious.
And you want to take it with a lot of water, and you want to take it with at least some food so you don't upset your stomach
Precisely.
if it's that.
Right.
So in your opinion, you would counterbalance that. You would say, I would just do acupuncture. It's not worth going on the anti-inflammatory. Is it that much of a pain reliever?
The acupuncture, along with other recommendations like herbs, absolutely. Now, I'm not against the over-the-counter, the anti-inflammatories, because they can be really helpful. The concern is when they're used in increasing dosages for more and more prolonged periods of time, and how that may mask other things. And that's certainly the case when we start to talk about using the birth control pill as a means of managing this, because that can have downstream effects.
But I'm sure you have a lot of women on birth control pills that come to see you.
Absolutely.
I mean, that's
It's
just
not a cure. It mitigates it. It doesn't eliminate cramping altogether.
Right.
But it does help regulate it. All right, great. I learned a lot about menstrual cramps. We're going to take a break. When we come back, something I'm feeling right now from sitting in this chair too long, back pain. Welcome back to Dueling Doctors. Today, our holistic and conventional experts are debating the best ways to treat pain. We're now going to talk about back pain, which affects an estimated 26 million Americans. Back pain is a common complaint. Most people experience back pain at least once in their lives, and it is one of the most common reasons people visit their doctors. Usually, it resolves on its own. Chronic back pain can be debilitating and may signal an underlying issue. As always, our experts have up to 1 minute to present their treatment plan. Dr. Azar, you are up first. I'm sure you see a lot of this being a rheumatologist.
I see this day in and day out. It's actually the second most common reason for a doctor's visit in this country.
I actually think it is the second biggest problem because besides headache, I hate back pain.
Well,
It's one of the hardest things to treat.
It's very frustrating. I mean, no two patients are alike, I have found. And I think it's important for the viewers to get one piece of information before we talk about therapy, and that is, you know, what distinguishes chronic pain that's sort of from chronic degenerative disc disease from a more important entity, okay? So we're talking about, you mentioned that, you know, chronicity, but if there are any other warning signs or symptoms that you should see your doctor sooner rather than later, such as fever, chills, night sweats, weight loss, a history of trauma that would suggest fracture and needing a workup for osteoporosis.
So let's even go back further. So the back is not just this one entity.
Correct.
It's a spinal cord, it's bones, it's vertebrae, which each are their own little segment.
Correct.
And then we have muscles.
And ligaments.
So there's so many variables that go into back pain. And what you mentioned there was, you know, risk of fracture due to a fall, fever, which could be an abscess, something like that. So first you're looking at what part of the back is the back pain coming from.
Right.
Okay.
And taking a really good history. I mean, we can't rely on imaging. Imaging is not even indicated usually in the first 6 weeks to 3 months of back pain.
I mean, how many times do you get a phone call? I need an MRI.
Exactly.
No, you don't. You need to come in.
After 2 days of pain. Correct. The majority of back pain will resolve after 3 months. So when you've taken a careful history and you're pretty certain that this is, you know, run-of-the-mill degenerative disc disease, then we start talking about therapy.
So degenerative disc disease, briefly again, is like you're actually the disc space between each vertebrae is starting to shrink, and you're getting bone on bone, and or it's moving, and you're getting the nerves pulling.
Correct. Those discs function basically as shock absorbers, and they can shrink, and then you can get bone on bone. They can also bulge or herniate, and then abut or hit the exiting nerves and cause sciatica pain.
And one of the most important things to avoid disc shrinking is smoking. There's been a severe link of those to quit smoking immediately, because that's one of the things that is affected by bad backs.
Exactly.
All right, so you've elucidated that, you've narrowed it down, and then your approach would then be?
My approach then also depends on the patient, how young they are, how old they are. The first line therapy still goes back to over-the-counter analgesics and anti-inflammatories like Advil and Motrin. They need to be used judiciously, meaning that we don't want people taking around-the-clock anti-inflammatories.
Which they could very well and become addicted to them.
Which they do. They absolutely self-medicate.
And then they want Percocets and codeine.
Exactly. I think that an important transition that's been made and evolution in the last couple of years in our understanding of treating chronic pain is that patients, at a certain point, their arthritis is no longer the focus of where the pain is originating. Their pain sort of turns into what we call more neuropathic pain, which means that the central nervous system or brain is amplifying that pain signal.
All right, so Dr. Noah, treating back pain, probably from your standpoint, I'm going to say acupuncture is going to be first on your list. It's probably one of the best ways to treat back pain.
Absolutely. Acupuncture is fantastic. There are studies that show that acupuncture can be at least, if not more effective in many cases, for treating acute as well as chronic back pain.
And to break that pain cycle.
And to break that
because
pain.
Because as Dr. Azar just said, that's what it is. You're amplifying
that pain cycle is a huge issue. And what we do is, through the acupuncture, we can reduce the muscle spasms. We can reduce the inflammation.
And you're directing this right on the back.
With other conditions, there may be points locally, right around where the pain is, but also points elsewhere, like higher up in the back, down by the feet, in the hands. And these points help to change the way the brain processes the signaling of this pain.
So acupuncture could actually break the spasms, break the pain cycle.
Break the spasms, break the pain cycle. Release endorphins and enkephalins, which are your body's natural painkillers, so that helps a lot as well. And it supports the body's innate self-healing mechanisms, which are what we're trying to do. I mean, pain management, Whether it's acupuncture, over-the-counter medications, it's all perfectly legitimate, but what we want to do is heal the underlying problem.
Okay, any supplements you could take possibly?
Absolutely. You can get lots of things in your health food store. One, turmeric, which helps to reduce nerve signaling. Capsaicin, which is the active ingredient in cayenne pepper, is
right.
great.
Now, is that topical or
you can
oral?
Lots of topical ointments and plasters have that in it. Arnica is great. You can take that as well orally.
Really? Arnica orally?
Arnica you can take orally. There are also topical applications, ointments of that can help reduce some of the muscle spasms and local pain.
All right. Before we go briefly, Dr. Azar, is there anything else we could take that might be a medical equivalent to acupuncture?
Yeah, I think what we talked about, this neuropathic pain, that the brain is kind of on overdrive. The neurotransmitters that's thought to be very much responsible for that is one called norepinephrine. And that helps, and that is sort of what we believe involved in that pain processing and signaling abnormality. So newer medicines that are actually pharmacologically work as antidepressants, like Cymbalta, for example,
so the
raise norepinephrine. The
which
SNRIs.
is serotonin reuptake norepinephrine inhibitors, very long name, but they work on that
They work on
neurotransmitter you just said,
norepinephrine, and
norepinephrine.
they have this is out of the fibromyalgia literature, and it's worked wonders for patients
So
with
those
low
are
back
people
pain.
that are really in chronic pain
Correct.
and need something that's daily, because it's not
Correct.
something you could
This
just
is-
take periodically.
that's
I just
correct.
want to make sure
Yeah.
we say that. All right, you guys, we need to go and wrap things up. I learned a lot today about back pain and other methods of pain relief. I want to thank you both for joining me today and for offering some great information to help our viewers better manage the pain in their lives. We'll be right back with my final spin on coping with pain. We all know physical pain, from the very first time we fell on the playground or touched a hot stove. And regardless if you're a believer in Eastern or Western philosophies, when you are in pain, the main objective is to get rid of it. Migraine sufferers need to know their triggers, and when a migraine comes on, reach for magnesium and try to lie down in a dark, quiet place. For chronic menstrual cramps, rule out secondary causes like fibroids or endometriosis, instead of masking the pain with anti-inflammatories. And finally, for back pain sufferers, prevention is the key. Maintain a healthy weight to reduce the strain on your lower back and take part in low-impact exercise to strengthen the muscles. I'm Dr. Frank Spinelli. Hope to see you soon for more healthy discussions as you discover your path for your own personal prescription on Dueling Doctors. And as always, be sure to talk to your healthcare provider first before making any decisions about your healthcare. We'll see you next time.